Living the life. First of all, NHS England, NHS Improvement, together with Public Health England, have launched their latest Help Us Help You campaign, NHS Access, which addresses the barriers that are discouraging patients from accessing the NHS across priority services.
Yes, indeed. And the COVID-19 pandemic has presented the NHS with one of its greatest ever challenges. And one serious impact is that some people are reluctant to use NHS services, citing concerns about being exposed to the virus, obviously, and not wanting to be a burden on the NHS. But tonight, we have Dr Sayyada Mawjii joining us to tell us more about the campaign. And that is going to be really interesting.
Yes. Assalamu alaikum.
Wa alaikum salam.
Dr Sayyada, Jazakallah khair for joining us. Welcome to the show. Now look.
Oh, thank you.
Naturally, there seems to be more COVID in hospitals than outside. That's the feeling, isn't it?
So I think there's a lot of fear around, this basically, which is why the NHS has, done this particular campaign on the, access phase of the Help Us Help You, and essentially it's to encourage, to highlight to the public that the services are still available and you will be seen safely. So even though there are patients with coronavirus in hospitals, there are protocols and procedures in place for patients to be seen, and that's exactly what this whole campaign is about.
I mean, I think, Imran, we've had this discussion before on the show. A lot of people have basically been neglecting their appointments.
Yes.
Have you come across a lot of that as well?
Absolutely. I haven't come across it myself with my family, for example, but I can totally understand that it's a fact and the statistics don't lie. And I wanted to actually ask you, Dr. Sayyada, why has this campaign come about now, like 9 months after the pandemic actually first began, for example?
Yeah. So with COVID, with the whole pandemic, we've seen so many changes. We've seen changes to the way that the, to the different services that have been running. We've also seen huge changes to the way that patients are accessing these services as well. It has had a big impact. So it's just some stats. So 1 in 5 people said that they didn't want to be a burden on the healthcare service. And a similar sort of number of people said that they were frightened or had a fear of getting coronavirus or themselves or passing it on to others. And this was one of the major reasons for them not getting help. We've also seen that sort of the, Black, South Asian and minority ethnic groups have disproportionately been affected by COVID. So again, this has been sort of a big fear. If I, attend my routine hospitals, if I go to, or if I have certain symptoms and the doctor might send me into hospital, there's a lot of fear around catching coronavirus.
That's almost, well, you could say 40% potentially of the public that are not, fulfilling their appointments. And
the worrying sign is that some of these people are, in critical long-term illnesses, and they really should have been, coming into the hospitals, etc., to look at it. So tell us, how long has this NHS Access campaign been in the making?
Yeah, so this is a recent campaign, it's there to highlight sort of that these services, even though that we did see some changes initially, the usual services are running, and the main sort of ones to highlight are sort of cancer services, maternity services, mental health services, and even just routine appointments. So patients shouldn't be scared of sort of attending these appointments. So that's sort of the main sort of kind of reason for this particular campaign. And just, another thing just to highlight is that we found that like you said, people are delaying. So 4 in 10 people, we found that they would leave it longer to get health advice than they normally would have before COVID.
Sure.
And again, this delay can have serious consequences on health.
So just to put the viewers' minds at ease, what has the NHS done to kind of make hospitals safer for people to visit?
Yeah, absolutely. So there's been sort of a range of measures that have been put in place. Lots of protocols and procedures have been put in place, including sort of COVID secure wards, so sort of areas of the hospital which are sort of COVID safe, as you know,
Sure.
you're sort of separated from COVID patients, also protected cancer sort of surgical hubs, and even sort of routine appointments. Some of them have switched into either telephone or video consultations. So there's really no kind of reason to be missing these really important appointments.
I mean, look, on that note, hospitals and visitation especially, it's been very difficult for people having a patient in hospital, a family member, not for COVID related, but even for other reasons, and they've been able to visit them. How difficult has that been for the NHS to cope with, knowing that the people, you know, obviously they're under pressure, people want to come and see them, you can't, you know, allow them in, it's not safe. You know, what's that experience been like?
Yeah, it has been a really, really tough time, you know, both for sort of the patients and the public that are facing this, the relatives who have sort of, you know, unwell family members in hospital, and even just, you know, and even the healthcare service itself. And, you know, we are trying to get things back to normal, you know, slowly, but again, it's going to take some time. But everyone has been working really, really hard in these really difficult circumstances.
Okay, Doctor. Just to move away from the COVID-19 for a moment, Doctor, why is this campaign focusing on cancer and potentially, you know, finding cancer? Why is that a big thing right now for your campaign?
Yeah. So what we found when the pandemic sort of hit sort of around April time, we found March, April time, we found that there was a big reduction in the number of patients that were presenting with cancer symptoms and the number of sort of urgent referrals that GPs were doing compared to sort of prior to the pandemic. And this is obviously really worrying because it shows that a lot of patients aren't coming forward. They're sort of sitting on their symptoms. You know, I'll just don't want to go in. It's not going to be anything serious, and so that's why this particular campaign is sort of focusing on cancer. There's also, again, in particular, sort of in our communities, we found that there is sort of a reduced kind of recognition of particular cancer symptoms. Sometimes these are just ignored, or again considered kind of a bit of an inconvenience. And they don't really want to come forward to burden the GP. So it is really, really important that if there are any symptoms that you do come forward and you do speak to your GP.
Just on that note, what are the kind of symptoms that people should be looking out for? Because first thing is that a lot of people don't even know what they should be looking out for.
Yeah, exactly. So each cancer obviously will have its own sort of specific symptoms, but generally, if there's any sort of unexplained bleeding, so any you know, blood that's in the stool or in the urine, any unexplained lumps that are found, any lumps or bumps, any sort of weight loss that's sort of sudden or unintended weight loss, these could be sort of signs of cancer. And sort of just also highlighting a little bit about the abdominal cancers, which account sort of for 26% of all cancers. So any sort of changes to the bowel habit, so any diarrhea, constipation, any bloating or discomfort in the sort of abdomen. So these are all kind of symptoms to be aware of. And I'd sort of, you know, really, really encourage patients that if they do notice any signs, or even if it's not these particular signs, but they generally think that something's not right or they feel unwell, please don't hesitate to contact your GP.
Okay, fantastic. And speaking about cancer screening, you know, to make that easier for the patients as well, whether there has been improvements or not, what has been done? Like, you know, what's different with the cancer screening now?
Yeah, so cancer screening has now resumed. Sort of, you know, it's all sort of restarted. So if you were due for a particular sort of cancer screening appointment, appointment letters have been sent out to everyone. So again, it's safe to attend these appointments. Like I said earlier, a lot of work has gone into making sure that these services are all safe for patients to attend. Again, cancer screenings are so important to attend because this is to identify any patients who might be sort of at a higher risk of, developing cancer. So you're picking up cancers early on by attending your screening. So it's for healthy patients who might not have any symptoms. And again, we've seen that within our community, so in the Black, Asian and minority ethnic communities, a lot of patients sometimes don't even attend at all to any of the national screening programs. So by the time they sort of, do present, they've already got certain symptoms, and it might be too late to sort of to treat the cancer. Whereas cancer screening aims to sort of pick it up early and, hopefully prevent the cancer.
On that note, obviously, a lot of resources were pushed towards COVID, when the pandemic happened. Are the NHS in a position now things are a bit more balanced? Because I know that some of the procedures, some of the less urgent surgeries, etc., were cancelled. Where are we now as an organisation at the moment?
Yeah, so you're completely right. And so at the moment, elective sort of appointments are still, so routine appointments as such are still going ahead. Like I said, if they're not sort of a physical appointment, they might be telephone or a video sort of consultation. But these services that were there before, they are still all here. I think there's just been we've seen a lot of change in just how the patients are accessing these services. And like I say, a lot of it comes down to kind of the being sort of scared to attend. So at the moment, these usual services are back. And if they're not, then your GP will, let you know, or the hospital will let you know, and sort of give you another appointment.
I'm going to throw a difficult question at you and put you on the spot a bit, and it's fine if you can't answer because it's a tough one. Is there any statistical analysis of, are there locations across England and Wales that many people are not turning up at hospital more than other areas? Is there any idea of how people have reacted to COVID and not attending the appointments?
Yeah, I don't know about particular sort of specific areas, but in general, we have seen a big reduction in patients attending. Like I say, even for sort of in emergency kind of situations as well, they might kind of sit on symptoms more because they're just worried that if they present to their doctor and they get sent into hospital, there is that fear. And again, like I said earlier, a lot of patients are just also, they don't want to burden the healthcare system. They feel like, the NHS is already stretched. It's fine, I've got, my symptoms will go or whatever. So they're not kind of approaching their doctor as they usually would. So we just want to sort of really, really encourage the listeners today that, don't be frightened and don't hesitate to speak to your doctor and reach out if you do have any of the symptoms or any other concerns.
Can we also imagine for a moment that, it's understandable, so they shouldn't feel bad if they're isolating, for example, and they can't make an appointment because they're isolating. And many people have isolated once, twice, 3 times, for example, during this period, on top of the actual national lockdowns as well. So there is an understanding there as well. But I think people should really confide in their GP and speak to them, call into the GP centres and explain that, look, I can't make my appointment or, what have you. For our viewers watching today, what could you say as general advice, to wrap up everything we've spoken about the Help Us Help You NHS Access campaign? What advice would you like to give our viewers today?
So my advice to the viewers and the listeners today would be that if you do have any symptoms that might be suggestive of cancer, if you have a maternity concern, because the other thing we also found was that mothers weren't sort of coming forward and with any concerns about babies as well, or even if it's just a routine appointment, the NHS is here to help you, and you will be seen in a safe way. So please don't hesitate to come forward and to access the help that you need.
What about the vaccine now? I mean, how is that going to... Is there a pressure on the NHS to deliver the vaccine? Of course, a lot of centres have been developed. Vaccines arrived. First people got it yesterday, I believe. What's happening around the vaccine?
Yeah, so with the vaccine, again, so this is sort of, another thing that's being sort of rolled out. But again, this will be rolled out sort of, it's probably quite, slowly, and there's phases. So there's, different sort of priority groups for the vaccine. And like you say, we saw that sort of being rolled out yesterday. So we'll continue seeing that. And patients, will be contacted as well by their general practitioner about, the vaccine in particular.
And what's it been like for you as doctors and nurses to see a possible solution to the pandemic?
Yeah, it's been good news to hear about the vaccine. I think, you know, for all of us, it's been a really sort of, can only describe it as a really long, you know, dark sort of tunnel the entire year. So to get this at the end of the year, it's definitely been positive news. And, you know, inshallah, we just pray that, you know, that we see kind of an end to this all.
Inshallah, inshallah. And obviously, like, you know, there's so many people that are now worried about the vaccine. So almost as much as they're worried about COVID. So, you know, again, we need to reassure our viewers as well that everything's tried and tested. It's being supported by our, you know, our GPs all across the country. So, you know, if they need it and if it's available, they should all be going for it. And again, you know, you're reiterating that if you're ill and you've got the cancers, then naturally you need to go and get it dealt with now before it gets out of control.
Absolutely, yeah, absolutely, and that's, you know, that's the most important thing that we want to highlight today. Don't wait, don't sort of, you know, sit around on symptoms. Please get it checked out.
And look, on a kind of, I was going to say a lighter or maybe an empowering note, you know, mashallah, the NHS without a doubt, and many other frontline workers have now really been seen as heroes. And how do you think that will help, you know, future generations of wanting to join and become nurses, get involved in the NHS? What kind of impact has it had on the PR of the role?
Yeah, I think we've, like you say, it's been such a difficult time, but it's really highlighted, you know, everyone coming together in this really, really difficult period. And, you know, inshallah, I really hope that it encourages, you know, the young listeners who are, you know, listening to the program today, to sort of, you know, take on those roles as well. Yeah, inshallah.
See, I think it works both ways.
I've always wanted to become a nurse.
A nurse?
Even when I was younger, wallah.
Oh, mashallah.
Even when I was younger, my wife still reminds me, she said, you all want to be a nurse.
Okay.
I've always wanted.
You can still go for it. You can still go for it.
I'm 56. I don't know if I could take time out to study for 3 or 4 years or something.
Hey, look, you never know.
Can.
Exactly, or inspire other people to be nurses.
Others.
How about that?
Exactly,
Indeed.
yeah.
In them days, male nurses was a thing of the past. I mean, I'm 56 now. She's talking about 30 odd years ago, and I was thinking about those kind of things.
Subhanallah. But no, you are 100% right. So even the people who are in the NHS, those frontline workers, the GPs like yourself and stuff, is naturally giving you experiences that you probably never thought you'd have to, you know, go through, and it's only made you more wiser and more skilled. Would you say that was the case for yourself, having to read up on so many things that you didn't expect to?
Absolutely. I think we've seen so many changes this year, and just constantly having to adapt and to adjust to new sort of information that kept coming out, new research. And it really has, it's been an incredible year of, you know, learning and sort of constantly having to adapt to it all. But alhamdulillah.
Well, look, before I ask you a reflective question, your advice, just to sum it up, for anybody who's watching today, they've got any type of illness, especially around the cancers you mentioned, let's just sum that up once again. What should they be doing? Yeah,
so if you notice, if you feel like you notice any particular symptoms, any cancer symptoms that I sort of mentioned earlier, so any unexplained bleeding, any unexplained lumps, any changes to, you know, any tummy pains or any weight loss, anything like that, please, reach out to your doctor, speak to your doctor and be seen. And also that, you know, the maternity services, mental health services are all still available, and also routine appointments, and you will be seen in a safe way. So don't sort of worry about, you know, avoiding or not attending these appointments.
Sure. Inshallah. Look, looking forward, I don't know how old you are, I don't know your status in marriage or anything like that, but looking forward 10, 20, 30, 40 years down the line, inshallah, you're married, have children, grandchildren, and you can look back at 2020 and this pandemic. What would you say to those children around you? What was it like, grandma or whatever? What would be a historical context for you to try and sum up the pandemic?
Yeah, I think it's been such a challenging year, but I think, alhamdulillah, it's really, do you know what, this time that I know we've had sort of lots of lockdowns and things, but I think this time has really, even though, I mean, through it all, I've been working throughout the whole thing, but it's really given us the time to sort of appreciate, but for me in particular, I feel like I've really had the opportunity to now appreciate all the little things that we've been given, you know, family, loved ones. I think it's kind of, for me, I feel like it's time sort of has stopped in a way, and it's instead of just kind of constantly, you know, running from one thing to another, it's really made me stop and realize, actually, do you know what, we have so much, and it's to just appreciate everything that we've been given. And yeah, alhamdulillah, it's been a crazy year.
It has indeed, subhanAllah. A beautiful message.
That was a crazy year, son.
It was a crazy year. And now eat your breakfast.
Well, look, Jazakallah khair, fantastic. Thank you for the advice
so
and
much.
tips. And people watching, you know, get back to the routine appointments and make sure you get checked up early. It's safe, inshallah. Jazakallah khair, Dr Sayyada. Pray you and your family keep safe,
Thank you so
inshallah.
much.
Inshallah.
Inshallah, thank you.
Assalamu
Jazakallah.
alaikum wa rahmatullahi wa barakatuh. Right,
Alaikum
Dr.
salam.
Sayyada.
Living the life.